the pandemic has shown us that we were not prepared. So if you want to prepare, let's not go for the low-hanging fruits, because you do not build the systems with low-hanging fruits. Building systems, it means that you build brick by brick, and every brick counts. There is no brick which is more important than the others, but we need to really make sure that you get all the pieces together. And one of the most important one is the health workforce. And when I talk about health workforce at primary level, it's community health workers and health workers in facilities. When Ebola came, we already highlighted, that these health systems were very, very weak, very much driven on tertiary care and not really on primary health care. Because it's just much more attractive, to finance a big hospital or teaching hospitals, because they're sitting in capitals where our politicians are. And, the primary healthcare center or community health workers, they are mainly forgotten. And let's just remember, the backbone of the primary healthcare systems are, first of all, healthcare workers. The pandemic has also demonstrated, that there's a really trust issues in many communities, between communities and public services in this particular sense. And if the information and media does not really play adequately their role, it's just fuels, this misconcept, these misperceptions which existed already before, and just fortify the belief of some communities, that government is not really there for them. And whatever is then proposed as a solution is then completely misinterpreted. Primary healthcare, as a basis, is more about preventive care than actually curative care. I mean, they're doing curative care as well. And we always say, prevention is better than cure. So if we can get to this place, we will reduce at the same time healthcare costs. We will be alleviating those communities from their disease burden, but also we will be enabling them of having much more household income remaining in the households rather than spending on healthcare costs. We shouldn't be looking at health anymore as an expenditure portfolio, but we should be looking at health as an investment portfolio where you have direct impact on GDP, but also a direct impact on peace and security.